In this video lecture, we are going to talk about the meningitis, a very important topic in medical surgical nursing. Meningitis is the inflammation of the meninges. Now, what are the meninges? They are the three protective layers that cover and protect the brain and spinal cord. These layers are called the dura mater, arachnoid mater, and the pia mater. When an infection like bacteria or virus enters the body, it can sometimes reach the brain and cause inflammation of these meninges. The condition is called meningitis. There are several types of meningitis based on what caused the infection. Bacterial meningitis is the most dangerous form. It needs urgent treatment with antibiotics. Common bacteria include Streptococcus pneumonia and Neisseria meningitidis. Viral meningitis is more common but usually less severe. It is often caused by viruses like enterovirus and herpes simplex virus. Fungal meningitis is rare and usually affects people with weak immune systems, such as those with HIV or cancer. A common fungus is Cryptococcus neoformans. Parasitic and non-infectious meningitis are less common and can result from parasites, certain medications, cancer, or autoimmune diseases. The most common cause of meningitis is infection, either by bacteria or viruses. Let's look at some of the risk factors of meningitis. Weakened immunity, like in HIV, cancer, or after organ transplant. Injury to the head that allows germs to enter the brain. Surgery involving the brain or spine. Living in crowded places such as hostels or military camps. Infants and elderly people because their immune systems are weaker. Now let's understand the pathophysiology of meningitis. When bacteria or viruses enter the bloodstream, they travel to the brain. There they infect the meninges. The body's immune system responds by releasing the chemicals to fight the infection, but this causes inflammation, which increases the pressure inside the skull, a condition called increased intracranial pressure or ICP. This pressure can press on the brain, reduce blood flow, and can lead to serious problems like seizures, coma, or even death if not treated quickly. Now, let's talk about the symptoms a person with meningitis will have. The most common symptoms include fever, severe headache, stiff neck, nausea and vomiting, sensitivity to light called photophobia, confusion or drowsiness, and seizures. There are also two classic signs that nurses check for. Kerning sign is when the patient is lying flat and you try to raise their leg with the knee bent. It causes pain in the back and resistance to straightening the leg. Brudzinski sign. When you lift the patient's head towards the chest in spine position, it causes their knees and hips to bend automatically. In infants, the symptoms are different. You may see a bulging soft spot on the head called fontanelle, a high pitched cry, poor feeding, lethargy, or low energy. To confirm the diagnosis of meningitis, several tests are done. Let's explain them clearly. Lumbar puncture or spinal tap is the most important test. A needle is inserted into the lower back to collect the cerebrospinal fluid or CSF. This fluid surrounds the brain and spinal cord in the subarachnoid space. In bacterial meningitis, the CSF usually shows high white blood cells, high protein, and low glucose. In viral meningitis, the glucose is usually normal and the WBCs are mostly lymphocytes. Blood culture to check if bacteria are present in the blood. CT or MRI scan to see if there is brain swelling or bleeding before doing lumbar puncture. CBC or complete blood count to check the number of white blood cells and the signs of infection. Treatment depends on the type of meningitis. For bacterial meningitis, start antibiotics immediately, even before the test results. Common antibiotics are ceftriaxone, vancomycin, ampicillin, especially for newborns or elderly. For viral meningitis, treatment is usually supportive, meaning rest, fluids, and medicines to reduce the fever and pain. In some cases like herpes virus, acyclovir may be used. For fungal meningitis, antifungal drugs like amphotericin B are given. Other supportive treatments may include IV fluids to prevent dehydration, antipyretics like paracetamol for fever, anticonvulsants to control seizures, and oxygen if breathing is affected. As nurses, we play a major role in caring for patients with meningitis. Let's look at some important nursing diagnoses first. Acute pain related to headache and inflammation. Risk for ineffective cerebral tissue perfusion related to increased intracranial pressure. hypothermia related to infection, and risk for injury due to possible seizures. The nursing interventions include monitor vital signs, especially temperature, respiratory rate, and neurological status. Perform neurochecks like checking pupil reaction and the level of consciousness. Maintain a quiet and dark environment to reduce brain stimulation. Place the patient on seizure precautions like bed in low position, padded side rails, oxygen and suction ready. Administer all medications on time, especially antibiotics. Maintain fluid balance, encourage fluids unless contraindicated. Educate the patients and family about the importance of completing the course of antibiotics, infection control, and vaccination. Meningitis can often be prevented with proper measures. Vaccination is the most effective method. Important vaccines include meningococcal vaccine, pneumococcal vaccine, and Haemophilus influenza type B vaccine. Avoid close contact with infected people. Practice good hand hygiene, hand washing, and not sharing the utensils. Early treatment of ear, nose, and throat infections. To sum up, meningitis is a serious infection that affects the brain and spinal cord. Quick diagnosis and treatment are crucial. As nurses, we must be able to recognize the symptoms early, support the patient with proper care, and help in prevention through health education and vaccination. Thank you for watching. That was all about the meningitis.